When you start feeling unwell with symptoms like fever, cough, or body aches, you might wonder if you have the flu. Doctors use a systematic approach to diagnose influenza, ensuring that patients receive the right treatment and care. In this video, we'll walk through the step-by-step process that healthcare professionals follow to determine if someone has the flu. From the initial consultation to laboratory tests, each step plays a crucial role in making an accurate diagnosis. Let's begin by understanding why a precise diagnosis is important and how it can help prevent complications and the spread of the virus. The first step in diagnosing the flu is recognizing the symptoms. Patients typically report a sudden onset of fever, chills, sore throat, cough, runny nose, muscle aches, and fatigue. Doctors pay close attention to these symptoms because they often appear abruptly and are more intense than those of a common cold. By carefully listening to the patient's description of their symptoms, healthcare providers can begin to form an initial impression of whether influenza might be the cause. This early assessment is essential for guiding the next steps in the diagnostic process. After noting the symptoms, doctors take a detailed medical history. They ask about recent exposure to others with flu, travel history, vaccination status, and any underlying health conditions. This information helps doctors assess the likelihood of influenza and identify patients at higher risk for complications. Understanding the patient's background allows for a more tailored approach to diagnosis and treatment, ensuring that vulnerable individuals receive prompt attention. Next, the doctor performs a physical examination. This involves checking the patient's temperature, listening to their lungs, and examining the throat and nose for signs of infection. The doctor may also look for other symptoms such as rapid breathing or dehydration. The physical exam helps confirm the presence of flu-like symptoms and rule out other possible causes, such as bacterial infections or allergies. Doctors also assess risk factors that could make flu more dangerous for certain patients. These include age, very young or elderly, pregnancy, chronic illnesses like asthma or diabetes, and weakened immune systems. Identifying these risk factors is crucial because it influences the urgency of testing and treatment, as well as the need for additional monitoring or hospitalization. Flu symptoms can overlap with those of other respiratory illnesses, such as the common cold, COVID-19, or bacterial infections. Doctors use their clinical judgment to differentiate between these conditions. They consider the pattern and severity of symptoms, as well as the time of year and local outbreaks. This careful evaluation helps avoid misdiagnosis and ensures that patients receive the most appropriate care. Not every patient with flu-like symptoms needs laboratory testing. Doctors decide to order tests based on the severity of illness, risk factors, and whether the results will change the course of treatment. For example, testing is more likely in hospitalized patients, those with weakened immune systems, or during outbreaks in closed settings like nursing homes. This selective approach helps use resources wisely and avoids unnecessary procedures. Several types of tests are available to diagnose influenza. The most common are rapid influenza diagnostic tests, RIDS, which can provide results in 10 to 15 minutes. Other options include rapid molecular assays, viral cultures, and reverse transcription polymerase chain reaction, RT-PCR tests. Each test has its own advantages and limitations, and doctors choose the most appropriate one based on the clinical situation and available resources. To perform a flu test, a sample must be collected from the patient. This is usually done using a swab from the nose or throat. The healthcare provider gently inserts a swab into the nostril or the back of the throat to collect secretions. Proper technique is important to ensure the sample contains enough virus for accurate testing. The process is quick and causes only mild discomfort. Rapid influenza diagnostic tests, RIDTs, are commonly used in clinics and hospitals. These tests detect viral antigens and can provide results within minutes. However, they are less sensitive than molecular tests, meaning they may miss some cases. Despite this, RIDTs are useful for quickly identifying flu in high-risk settings or during outbreaks, allowing for prompt treatment and infection control. Molecular tests, such as RT-PCR, are more sensitive and specific than rapid antigen tests. They detect the genetic material of the influenza virus and can identify different strains. These tests are often used in hospitals or for patients with severe illness. While they take longer to process, their accuracy makes them the gold standard for flu diagnosis, especially in complicated cases. Once the test is completed, doctors interpret the results in the context of the patient's symptoms and risk factors. A positive result confirms the diagnosis of influenza, while a negative result does not always rule it out, especially if the test was done early or the sample was inadequate. Doctors use their clinical judgment to decide on further action, such as starting antiviral treatment or ordering additional tests. Viral culture is another method for diagnosing flu, though it is less commonly used due to the time required. This test involves growing the virus from the patient's sample in a laboratory. It can take several days to get results, but it is useful for research, surveillance, and confirming unusual strains. Doctors may order viral culture in special cases where precise identification is needed. Serological tests look for antibodies against the influenza virus in the blood. These tests are not typically used for diagnosing acute flu because antibodies take time to develop. However, they can be helpful in research or for confirming past infection. Doctors rarely rely on serology for immediate clinical decisions regarding flu treatment. Point-of-care tests are designed for use at the bedside or in clinics, providing rapid results without the need for a full laboratory. These tests are especially useful in urgent care settings or during flu outbreaks, allowing doctors to make quick decisions about treatment and isolation. The convenience and speed of point-of-care testing help improve patient outcomes and reduce the spread of the virus. During community outbreaks or in closed environments like schools and nursing homes, doctors may increase testing to quickly identify cases and control the spread. Rapid identification of flu cases allows for timely treatment, isolation, and preventive measures for those at risk. This proactive approach is vital for protecting vulnerable populations and managing public health. For patients at high risk of complications, such as the elderly, pregnant women, or those with chronic illnesses, doctors are more likely to order flu tests. Early diagnosis in these groups is critical for starting antiviral treatment promptly and preventing severe outcomes. Special attention is given to these patients to ensure they receive the care they need. Hospitalized patients with severe respiratory symptoms are routinely tested for influenza. Accurate diagnosis helps guide treatment decisions, such as starting antivirals or implementing infection control measures. In hospitals, more sensitive molecular tests are often used to ensure reliable results and protect other patients and staff. Children are more susceptible to flu and its complications. Doctors may be more likely to test children with flu-like symptoms, especially if they are very young or have underlying health conditions. Early diagnosis helps ensure that children receive appropriate care and reduces the risk of spreading the virus to others. Pregnant women are considered a high-risk group for flu complications. Doctors are vigilant in testing and monitoring pregnant patients with flu-like symptoms. Early detection allows for timely treatment, which is essential for protecting both the mother and the unborn child from severe illness. Patients with weakened immune systems, such as those undergoing chemotherapy or living with HIV, are at greater risk for severe flu. Doctors prioritize testing in these individuals to ensure early diagnosis and prompt treatment. Special precautions may also be taken to prevent the spread of infection in healthcare settings. Older adults are more likely to experience complications from the flu. Doctors are proactive in testing elderly patients with respiratory symptoms, especially during flu season. Early identification and treatment can significantly reduce the risk of hospitalization and serious outcomes in this vulnerable group. In outpatient clinics, doctors use rapid tests to quickly diagnose flu in patients with mild to moderate symptoms. This allows for timely treatment and advice on self-care and isolation. Outpatient testing is especially important during peak flu season, when many people seek care for respiratory symptoms. Emergency departments often see patients with severe or rapidly worsening symptoms. Doctors use a combination of rapid and molecular tests to quickly identify flu and start appropriate treatment. Fast diagnosis in the emergency setting is critical for managing complications and preventing the spread of infection. In rural or remote areas, access to advanced laboratory tests may be limited. Doctors rely on clinical judgment and rapid tests to diagnose flu. Point-of-care testing and telemedicine consultations can help bridge the gap, ensuring that patients in these areas receive timely diagnosis and care. During flu pandemics, widespread testing becomes even more important. Doctors follow public health guidelines to identify and confirm cases, monitor the spread, and implement control measures. Large-scale testing helps track the virus and allocate resources where they are needed most. Public health agencies use flu testing for surveillance purposes. Doctors may be asked to submit samples from certain patients to help monitor circulating strains and detect new variants. Surveillance testing provides valuable data for vaccine development and outbreak response. Some countries or organizations may require flu testing for travelers, especially during outbreaks. Doctors provide documentation of test results to meet these requirements. This helps prevent the spread of influenza across borders and protects public health. Healthcare workers and other high-risk professionals may be tested for flu to prevent outbreaks in workplaces. Doctors play a key role in screening and advising employees on when it is safe to return to work. Occupational testing helps maintain a healthy workforce and reduces absenteeism. Schools are common sites for flu outbreaks. doctors may recommend testing for students and staff with symptoms to quickly identify cases and prevent further spread. Early detection and isolation are key strategies for keeping schools safe during flu season. Nursing homes house some of the most vulnerable individuals. Doctors are vigilant in testing residents with respiratory symptoms to quickly identify flu cases. Prompt diagnosis allows for immediate treatment and infection control measures to protect other residents and staff. When flu outbreaks occur in the community, doctors may increase testing to identify and isolate cases quickly. This helps limit the spread of the virus and allows public health officials to implement targeted interventions. Community testing is a key part of outbreak management. International travelers may be required to undergo flu testing before departure or upon arrival in certain countries. Doctors provide testing and documentation to meet these requirements, helping to prevent the global spread of influenza and protect public health worldwide. Large gatherings and special events can increase the risk of flu transmission. Doctors may recommend testing for participants with symptoms to prevent outbreaks. Early detection and isolation are important for keeping events safe and minimizing the risk of widespread illness. When multiple family members develop flu-like symptoms, doctors may test several individuals to confirm the diagnosis and guide treatment. Identifying family clusters helps prevent further spread within the household and informs decisions about isolation and care. Patients with chronic diseases like asthma, diabetes, or heart disease are at higher risk for flu complications. Doctors prioritize testing in these patients to ensure early diagnosis and prompt treatment, reducing the risk of severe illness and hospitalization. In cases where symptoms are severe or do not improve with standard treatment, doctors may order additional tests to rule out complications or co-infections. This thorough approach ensures that patients receive the most effective care and helps identify any underlying issues. Sometimes, patients with flu may also have other infections, such as bacterial pneumonia. Doctors may order tests for co-infections to ensure that all causes of illness are identified and treated. This comprehensive approach improves patient outcomes and prevents complications. In rare cases, doctors may test for antiviral resistance if a patient does not respond to standard treatment. This involves specialized laboratory tests to determine if the flu virus is resistant to certain medications. Identifying resistance helps doctors choose the most effective therapy. Doctors and public health officials monitor for new or unusual flu strains. Special tests are used to identify and characterize these strains, which is important for tracking outbreaks and updating vaccines. Early detection of new strains helps prevent widespread illness. Flu testing also helps evaluate the effectiveness of seasonal vaccines. Doctors and researchers compare test results from vaccinated and unvaccinated individuals to assess how well the vaccine is working. This information guides future vaccine development and public health recommendations. Researchers use flu testing to study the virus, track mutations, and develop new treatments. Doctors may participate in research studies by collecting samples and sharing data. Research testing advances our understanding of influenza and improves patient care over time. Flu testing is a cornerstone of public health response to outbreaks and pandemics. Doctors work closely with health authorities to report cases, monitor trends, and implement control measures. Timely and accurate testing helps protect communities and save lives. Diagnosing the flu involves a combination of clinical assessment, risk evaluation, and laboratory testing. Doctors start by recognizing symptoms, taking a thorough history, and performing a physical exam. They then decide if testing is needed based on risk factors and clinical judgment. Various tests, from rapid antigen to molecular assays, help confirm the diagnosis. This step-by-step approach ensures that patients receive timely and appropriate care, reducing the risk of complications and the spread of influenza. In summary, doctors use a systematic, evidence-based process to diagnose the flu. By combining clinical expertise with appropriate testing, they ensure accurate diagnosis and effective treatment. Understanding these steps can help patients know what to expect when seeking care for flu-like symptoms. Early diagnosis not only benefits individual patients, but also plays a vital role in protecting public health and preventing outbreaks. Stay informed, and don't hesitate to consult your healthcare provider if you experience symptoms of the flu.